I'm back, baby. You miss me? Now, it's been a while since I did a vlog on this show. Well, not really. The last one was my VR headset, which if you didn't see, you know, click on the info card and you can go watch that. What's goodies in that? And then if you missed the one before that, which was the Samsung unboxing, which goes with the VR, you can also click the, you know, info card annotation, all the goodies over in this corner, and you can go and watch those. But what I'm really here to talk to you guys about in this vlog, if you haven't already, you know, known from the title, obviously, that's why you clicked on here. But yes, I am back, you know, 2 weeks later. No, it probably only seemed like a week for you guys, but you know, it's 2 weeks for me. Now, I did explain in the Lost Truck episode 1, if you guys haven't seen that, also click the info card, and you can go watch that after this, or you can stop this, go watch it, and then, you know, come back. Totally your choice. I don't judge on how you enjoy your life. Just, you know, make sure you do go and watch that if you haven't already. And basically in that, I did mention that there might not be a video the next week. And basically I talked about my free art stuff. I guess you guys kind of wondering what kind of searching I did have, you know, I talked about it a lot. And it's probably not what you guys are thinking. I mean, if you watched the Cost Trucks video, obviously you have some idea, but you don't know the full extent of what they did, how they did it, you know, my experience of it. Give you a little 411 on what was, you know, what went down, what happened, and all the good, bad, gross, and everything in between for you guys. Okay, I guess. Okay, we're a few hours in. A few hours from, you know, the pivotal moment. It's the pivotal moment that we're about to, you know, get my teeth taken out. Just finished maybe, you know, breakfast, turned a hole. Someone forgot the bacon. Not gonna name names. Dad, mainly. Anyway, it's a few hours into my day. We're about to leave soon, and about to get my teeth, you know, stick with me, and I'll keep you guys, you know, updated. And should be fun, not for me, but should be a good experience for you guys to see. But anyway, enough said about that. I'm gonna go get dressed. Just want to give you a quick update about what's going on, and you know, we'll piece together as we go along, and hopefully there'll be something good that comes of this for you guys to watch. Even though I'm probably gonna be in a lot of pain in a few hours. Now I'm staying at my parents for the week until I recover and be basically on a liquid diet. Anyway, bye for now, and I will see you in a little bit. We're here now, so hopefully it's not too long of a wait, but I can record it in there. Hopefully I'll have something to show of the aftermath. Which, the big reveal is, I had all four wisdom teeth removed from my mouth. That's both top and bottom at the same time. Now this was done under local anesthetic. Obviously they could have put me to sleep, but you know, that would have cost money. Pretty much I got, you know, a lovely doctor to do it. He had a lovely assistant. I'm pretty sure she was laying the ropes, but basically all she had to do was, you know, pass him the tools, give him the needle, give him, you know, the strings and, you know, all the different tools that he would need throughout the surgery to do what he needs to do. And then also, you know, a little sucker that, you know, sucks out any of the water and any of the blood that, you know, forms in my mouth because, you know, I'm leaving it open, you know, drawing and whatnot. Kind of cleans that up so they can work in there. So they were really lovely. Obviously I can't say, you know, where I had it or whatnot. Not to say that there's any reason why I can't, because, you know, some people don't want to mention in videos, but that's okay. And that's also why I couldn't, you know, show you anything that was going on during, because I could not film it. I would have loved to have someone in there to film it so I could show you guys, kind of like a cut-up thing. I'll even do like probably a live stream and then do a cut-up video and stick it on my channel so you guys could watch, you know, along with me. You know, for the squeamish, probably wouldn't be the best, but you know, that stuff happens. And basically, after waiting a little bit, you know, you could hear him, you know, setting up chair and whatnot, because, you know, that's where the surgery was going to happen, was in this little room where there was this, you know, dentist chair, and you pretty much lay in there and they go to work, go to town on your mouth. And then when I went into the room, you know, set up on the chair and whatnot. The first thing they did was they gave me a needle so to numb my mouth so I wouldn't be able to feel any of the pain when they pulled out the teeth, because without it, it would hurt extremely. Now, it took them 15-20 minutes to get my mouth completely numb, because, well, I have this weird thing where I have a really bad gag reflex. Most notable when I had braces, which obviously they're the people that did my braces, they're the ones that suggested getting my wisdom teeth out, which is why I did it. They said I could either get it out as soon as possible, or I could wait until there was a problem. And I thought, well, if I get it out now, then you have a problem, then, you know, there might be a problem later on. It's easier to get them out when you're younger than it is to get them out when you're older, which the doctor did say when I was in there, which I also wait for the whole thing, to be honest. I mean, there was occasional times where I would, you know, flinch, because, you know, pain, especially near the end, I could start to feel it, because the pain was starting to wear off, but I was like, it's so close to the end, just nip it in the butt, get it done. It wasn't any more painful than, you know, when they tighten your braces, you know, stick in the wire, pull out the wire, you know, swap it over, put on the braces, change the colours, bands, all that lovely stuff, which I've had since, you know, grade 7, and got out on the beginning of this year. It was supposed to be a 2-year waiting list before I could actually get this done, but they had an early cancellation, so they were able to fit me in sooner rather than later, which I wasn't too happy about having to get it done, but I knew it would benefit me get it done sooner rather than later, so I was grateful for that. Once they, because of my bad gag reflex, which we found out was really bad when we went to, they have this new fangled technology where they stick a little bit of plastic, little square thing in your mouth, so they can, you know, x-ray your mouth without having to give you the big giant machine that goes around your head, and the dude who stands behind, you know, the brick wall, like she will, you know, with my bad gag reflex, you know, it was very hard to do it the old school way. Well, they couldn't do it the first time, and then they went, well, next time we're booking for another appointment, because that would have been my last appointment. We'll have the small one and we can try that. No good. So they had to use the big giant machine to do it the old school way. Luckily they still had them, which was the same problem they had with the giant, well, I wouldn't say giant needle, but reasonably sized needle. Anyway, well, anything looks giant that close up to your face. They managed to get the top left to go numb before they could do the other side. I kept gagging them and put it in because they had to put it straight to the back, which is not very good for me. And then eventually they did, after 15-20 minutes, they eventually got my mouth to go numb, and they could, you know, start the operation. And then for the most part, they, you know, just worked away, chipping out the tooth, pulling out a little bit, separating the root, cutting open the gums, blood, you know, whatever. It probably wouldn't be the nicest thing if I did all that thing for it anyway, probably get taken down, graphic imagery and whatnot, which is why I probably wouldn't be able to put up here, even if I could record in there, which I couldn't. I'd have to blur out a whole lot of stuff. But you've seen medical shows, you know, embarrassing body things, nips and tuck, all those shows, all those lovely shows ER that, you know, go over that kind of detail and stuff. So they took out the bottom two, they took out, I believe it was the top right first, I think. Yeah, I think it was the top right they started with, and then they did the bottom right, then the bottom left, and then the top left, which I remember distinctly because he started to pull it out, and I sort of feel it, but not really. I couldn't really feel what he was doing when I was cutting into it, but when he went to pull it out, I could kind of feel him yanking on it, whereas with the others I couldn't, unless he like touched a bit of my mouth that wasn't like the lips or something, or the outside of my mouth that wasn't numb, because it was mainly the inside of the gums, where he would be operating obviously, so I wouldn't feel it anyway, so I didn't really feel it much at the end. And then once it was all done and all over, they took me to another waiting area, because, you know, they went, and they gave me an ice pack, which was basically like a big ice pack with like ice on one side, ice on the other side, all filled up like an ice pack thing that went right around my face, which I'll show you a picture of. Hold on, don't look pretty. Couldn't have any makeup on it either. Well, I mean, I could have, but, you know, I had to redo it before I leave, and if I was, you know, hopped up on, you know, pain medication and numbing stuff and wasn't feeling too good, it wouldn't really be worth doing, because my dad did drop me off, and then, you know, he took the day off, and then he, you know, picked us up afterwards, you know, and I had to wait there. They gave me a form to fill out about, you know, how I felt about, you know, what they did and, you know, whatnot. And I couldn't stop praising the doctor, because, you know, he did really, really well. Even with the trouble we had of, you know, trying to numb my mouth, he actually did a pretty good job, and I'm pretty satisfied with it. And anyone else that, you know, needs that kind of done, I would highly recommend the place that I got it done. It's worked done with, but obviously can't mention legal reasons. But obviously, if you came to me in person and you needed that stuff done, I would definitely recommend you the same place, obviously. But you know, walk around, see what's best for you. Deals that are good for me aren't always good for everyone else, and deals that are good for everyone else don't always work out for me. So you know, shop around a bit, walk around, see what you want. And basically, then I went out into the other waiting room where my father was, and I had to go back in to check about the medication that they gave me, which was 2 lots of medication and a mouthwash, and second mouthwash to, you know, clean all the goobies and all the bacteria and all the stuff, so it doesn't form like clots and that in my mouth, and, you know, keep it all clean, which is, you know, open wounds, stitches, that kind of thing, you know, look after it. If they get infected, then it's no good to anyone. But, you know, I wasn't out of it too bad. It wasn't as bad an experience as I thought it would be, you know. It's actually quite manageable, the pain, over time. The worst part wasn't so much the pain as the ice pack. You know, you ever gotten frostbite? Probably not the same thing, but, you know, that feeling of really cold, held in one spot for a really long time. You know, like if anyone's put a big chunk of ice on your back and you just can't handle it. Made my whole face got really cold and it was really annoying. I really want to take it off, but I knew if I took it off, the pain would come back and it would be just as bad because I hadn't had any of the medication yet, and the stuff that was keeping the pain down was whatever the doctor gave me in the needle to, you know, numb my mouth, so I was still out of it in terms of my mouth. The rest of me was still fine, you know, a little bit drowsy. Not as much as what people said I would be. And then after that, for like the next week or so, I was basically laying, because we have a couch in front of the TV, kind of made that up into a bed. And the funny thing was, to avoid infection or removal of stitches, make sure you chew on the opposite side of the mouth to where the stitches and the operation was. And I thought, well, how can I do that? Because I got it done on the left, got it done on the right, top and bottom. I can't only avoid the left by going to the right and avoid the right by going to the left, because they're on both sides. So I had to chew on the front of my mouth, which made it a bit hard and a little slow going. I'm still not 100% was able to come home. Basically, apart from my mouth being a little bit sore down the bottom, I'm pretty much 100% fine to be up, running around, doing whatever I need to do. So I might as well come home. And since my pain medication ran out, I obviously don't need that, and most of the time I can deal with little bits of pain here and there. So I'm pretty much better now than I was during, obviously. Not as great as I was, you know, prior to it. And yeah, that's basically what. Oh yeah, and one other thing I wanted to mention too. Sorry about this, but my other battery just died. But I did want to say that I'm feeling much better now, after recovering. Thanks to my mum once again for looking after me. Thanks to my dad for getting me there and back. You know, hopefully I don't have to go through this again, which is, you know, not the nicest experience in the world. So hopefully in about a week or so, stitches will be completely dissolved, because they're dissolvable stitches, and I should be back to my 100% self again. I'll keep you updated, obviously. So thank you for watching. Sorry if this is a bit choppy. It's the first time I've done a proper vlog, camera to camera, without gameplay being associated with it. So hopefully I can do more of these for you in the future. So hopefully it won't be under these circumstances. But if it is, you know, all the better for more of the content. Hopefully you enjoyed watching this. I enjoyed filming this. Didn't really enjoy going through it all. Didn't really enjoy having to have the surgery. But what you gonna do? You do what you do so that you don't end up in more pain later on. Which is why I got it done sooner rather than later. And without further ado, subscribe if you haven't already. If you have, thank you. If you haven't, why not? Pretty good content. You liked this video, didn't you? Gave it a thumbs up. If you didn't, you know, give it a thumbs up now. And let me know in the comments section what you thought about this. Links to all the videos I talked about in the info card over there, as well as in the description. I will see you lovely people in the next video. Bye bye.